name's Pilar Lang, and this is a physical assessment on my patient here, who is a 30-year-old male. Do you understand that this is confidential and you have the right to refuse?
Yes.
Do you agree to be videoed and possibly have this reproduced and shown to others?
I do.
All right. So your history, you're a 30-year-old African American male. You exercise 3 times weekly. You would say that you're a little obese. You have trouble sleeping. You get 4 to 5 hours of rest each night. No smoking or drinking. And your previous illness were chickenpox, strep throat, and a common cold. So no major sickness.
No.
Alright. Your immunizations are up to date. Did you have any abnormal or unusual reactions?
No.
No previous surgeries or hospitalizations?
No.
Alright. And I see that you currently have a condition of hypertension and an and an allergy to amoxicillin.
Yes.
Alright. Alright, so I'm going to begin the physical assessment because I just went over his history. So what I'm going to do now, I'm going to stand here and I'm going to look at him. Right now I'm checking for symmetry and everything seems symmetrical. So I'm going to inspect and palpate his scalp. Inspect and palpate the scalp. Do you feel any pain?
No.
Alright, I don't feel any nodules. The hair is distributed evenly. Alright, I'm going to check the TMJ joints. Alright, can I get you to open and close your mouth? Alright, good. I don't feel any clicks or anything, so that seems fine. So I'm also going to palpate the bilateral temporal arteries and the maxillary and temporal sinuses. Alright. Let me know if you feel any pain or pressure. Frontal sinuses, I'm sorry.
No pain.
No pain or pressure. And that was the temporal, maxillary, and frontal sinuses. Alright, so cranial nerve 1, we'll be checking for smell. Do you have any issues smelling?
No.
Okay. Does your foods or your drinks taste different, smell different to you?
No.
Okay, good. So what I need you to do, I'm going to check for patency. I need you to hold one nostril while blowing out the other. Now I'm blowing the other. Okay, he has a little congestion to his left nostril, but the other side is patent. Alright, so I'm going to do cranial nerve 2, which is going to test his visual acuity. Alright, can I get you to stand here? What he's doing, he's going to stand here, which is measured 10 feet from here. And we're going to use this Snellen chart. Alright, can I get you to read that last line? Put one hand over your right eye and read.
LEFODPCT.
Good job. Can I get you to read while covering your left eye?
LEFODPCT.
All right, thank you. You can have a seat. So we did the Snellen chart to test for that visual acuity on the right and left, and that will give him a 20/20 at 10 feet. All right, so now I'm going to test cranial nerve 5. So with cranial nerve 5, that's going to be with his mouth. So I'm going to get you to clench your teeth. All right, open your mouth. That's with resistance. Close it. All right, good job. All right, so also I'm going to do the cotton whisk test. All right, let me know when you feel it.
I feel it.
All right. All right, I'm going to test cranial nerve 7. Can I get you to smile, frown, puff out your cheeks? You can puff them. Smile, frown, puff out your cheeks. Raise your eyebrows and close your eyes tight. Alright, so that nerve seems to be intact. So now I'm going to test the 6 fields of cardinal gaze. Alright, I'm going to place my finger here. And follow my finger with your eyes. Do not move your head. Alright, his cardinal gaze seems to be intact, which is a good thing. So I'm going to check his pupil size. Alright, I would say his pupil size is about a 3. He has a brisk reaction to light. They're round, they're brown. The hair on his lashes and eyebrows is evenly distributed. The sclera is white, no redness to his eyes. Alright, and I'm going to inspect his ears also. Only the external ear. Okay, I don't see any drainage or buildup. So now I'm going to do the whisper test.
$66. $72.
Alright, that was a pass on the whisper test. So now I'm going to move forward and look into his mouth, check his mouth. His hard palate is intact, soft palate intact. His mucous membranes are pink, moist, and intact. His gums look nice and pink, no bleeding. I don't see any signs of gum separation from the teeth. All of his teeth are intact. He's not missing any teeth. I'm going to check his gag reflex also. Alright, gag reflex. Now get you to say ah. Alright. I did see his uvula rise when I made him say ah. The gag reflex is intact. I do see a little redness to his throat. His tonsils are normal size. I don't see any residue inside them or on them. They're a nice pink color also. So now I'm going to check the lymph nodes. I'm going to check the preoculum, auriculum, post, occipital, submandibular, tonsillar, superficial, cervical, deep cervical chain, and supraclavicular. Alright. So here we are. Pre, post, Alright, they all feel spongy and movable. I don't feel any abnormalities. And symmetrical on both sides. Alright, I'm going to do cranial nerve 11, which is going to be range of motion of his neck and his head. Can I get you to raise your head chin to chest? Can I get you to go front to back? Side to side? And ear to each shoulder. Alright, he has a good range of motion with his head and neck. Did you feel any pain or stiffness while doing those motions?
No.
Okay, good job. So we're going to move on. Can I get you to do a shoulder stroke? Stroke your shoulders. Alright, with resistance. Alright, I'm not sure if I did any resistance with them, but yeah. So now I'm gonna do assess his thyroid and his trachea. All right, hold your neck up. All right, the trachea seems to be midline, symmetrical. It doesn't deviate to the left or the right. I'm gonna test his thyroid by getting him to swallow some water. And as he swallows the water, I should feel it go up and down, and that's what I'm gonna test for. No, that's not for you right now. I need you put it in your mouth. All right, swallow. All right, that was a hard swallow, but I did feel his thyroid go up and back down, back into place. All right, so now I'll take that for you. Okay, so now I'm gonna check his carotid. And you know you do that one at a time, never bilaterally. One moment. Okay, I have the stethoscope. All right, they're regular and symmetrical. I don't feel any. I didn't hear any bruise or swooshing sounds, so nothing abnormal with his carotid. All right, and I listened with the bell side. So now I'm gonna do his posterior chest. All right. Is it okay if you take your shirt off? All right. Then inspect that. Stand up for it. All right. And pull this up. All right. Have a seat on that side. Okay. For this, I'll be inspecting and palpating his posterior. So. I don't see any nodules, rashes, or anything. I see a few striae here to his left and right and mid back. Other than that, everything seems symmetrical and intact. Alright, so I'm just gonna palpate his back. Do you feel any pain or pressure?
No.
Alright. So now I'm going to check the tactile firmness. I'm gonna get him to say 99. All right, 99.
99, 99, 99, 99, 99, 99.
All right. So I did feel vibrations symmetrically on both sides. I'm going to percuss each side. All right, you're gonna feel me hitting you here. Let me know if you feel any pressure, pain, tenderness, or any of that.
Okay. No.
No pain, no pressure.
No.
All right. Now I'm gonna listen to your breath sounds. Deep breath. Breath sounds sound clear. I don't hear any rails, strider. I don't hear any bronchi, no alarming sounds. So now what I'm gonna do is I'm gonna percuss his vertebral angle which I'm gonna take my fist and hit the sides of his flanks. I want you to let me know if you have any pain or tenderness.
Okay.
All right, you ready?
No.
Any pain or tenderness?
No.
All right, good. All right, so moving on, I'm gonna do his anterior chest. So can I get you to come back around here? All right, so with this anterior chest, I'm gonna first inspect and palpate it. Everything seems symmetrical, looks symmetrical. Hair is evenly distributed. Again, I see striae here and there. He has a brand here and a brand to both upper extremities and a tattoo on his left shoulder that says blessed. All right, just palpate him. Any pain or tenderness?
No.
All right. So I didn't feel any pulsations or anything, or any irregularities. I'm going to palpate the radial, ulnar, and brachial pulses, and I'm going to do it bilaterally. All right. All right, they seem regular within normal limits. No bounding pulses. They're not weak or threading. I would say they're about a +3. So the pulses are great in both arms bilaterally. So next we're going to do range of motion of the upper extremities. So I'm going to ask him to raise your arms up, back down for me, back, okay, back, side, back down for me. And I want you to pronate and subnate your forearms. Flex your wrists. Good, good. All right, and I want you to open and close your hands. Make a fist. All right, now I want you to touch your fingers to each. Your thumb to each finger. All right. Club bottom up. Next, we're going to move on to cerebellar function. So I want you to spread your arms, and I want you to touch your finger to your nose. Good job. All right, and can I get you to do that, but speed up? Okay, that's a pass. So next, we're going to test the graphthesia, which is I use an instrument and draw or write something in the palm of his hand to see if he can tell me what it is by feeling it. Close your eyes, palms up.
P. T.
All right, that is correct. Next, I'm going to test the stereognosis, where he will feel an item and then tell me what the item is in his hand. All right, here's one.
A corn. Penny.
All right. All right, and the next one.
A berry.
All right, that's correct also. So moving forward, I'm going to test the tricep, bicep, and brachial reflexes. And to do that, I'm going to test his tricep first. All right, we got his tricep. All right. All right, we got a slight flinch with that one. All right. That was a flinch in his thumb. Alright, so now we're going to do the anterior chest. And with the anterior chest, we're not going to check for breath sounds. We're going to check for heart sounds, which is going to be the aortic, pulmonic, tricuspid, and mitral. And we're also going to do the point of maximal impulse. Okay, of the aortic, I did hear S1 and S2 sounds. I didn't hear any S3s or anything, which is a good thing. I didn't hear any adventitious sounds. No palpitations. Palpitations. And I'm also going to listen for murmurs, and I'm going to use the bell side of the stethoscope to listen. In the same aortic, pulmonic, tricuspid, and mitral. Alright, I don't hear anything, no abnormal sounds. Alright, his work of breathing was normal, is not labored, shallow, or irregular. Moving on, I'm gonna do his abdominal. Could you lay flat for me? Alright, looking at his abdomen, I don't see any alarming skin, rashes, no pulsations, nothing poking out, no hernias. He has an inverted umbilical cord. Umbilicus, navel. It's soft, round, no ascites. Do you feel any pain?
No.
No pain? Dang. Stretch it. I shouldn't have palpated. I shouldn't have. Okay, inspect. Now I'm gonna listen for vowel sounds. Vowel sounds are present and active. Oh, I'm gonna listen to the renal artery and aorta. Bell side. Right, I don't hear any bruits. Next, I'm gonna percuss over the parts that's filled with air. It's gonna be resonant, and where the organs are is gonna be dull. Alright, next I'm gonna do some light palpation. I'm gonna lightly palpate first, starting on the right side. Do you feel any pain or tenderness?
No.
Let me know if you feel anything. So you don't feel anything?
No pain.
Okay, next I'm gonna do deep palpation of his abdomen. Pain, pressure, tenderness.
No.
Alright, next I'm gonna palpate the liver. It's on the right side here, right below his ribs. Alright. Alright, so now I'm gonna move down to his lower extremities. Stay there. Alright, I'm inspecting his lower extremities. The hair is evenly distributed. Checking both of them for edema. No erythema either. No bruising, modeling of the skin, none of that present. So now I'm going to palpate his popliteal, his dorsalis pedis, and his posterior tibial. And I'm going to do them bilaterally. He's kind of thicker, so I'm going to palpate it deeply. Okay. All of them are strong, non-bounding, regular bilaterally. Alright, so I'm going to, while he's laying down, I'm going to do the Babinski reflex on the lateral side of his left and right foot. Alright, we got the expected reflex, which was for the feet to cringe down. Alright, I'm going to do range of motion next. Can I get you to raise your leg to a 90 degree? Alright, your left leg. Alright, can I get you to do knee to chest? Alright, flex your feet in and out. Okay. Alright, now I'm going to test the resistance. Pull, push. Good. Alright, so can I get you to sit on the side? You can sit up now. You can have your shirt back. A little privacy. Alright, so now I'm going to test the patellar and the Achilles. Alright, so for the Achilles, right on the right side, left side. And now I'm going to do the right and left patella. Alright, that one didn't want to jerk for me, but it gave me the expected reaction. So next I'm going to do the cerebellar function. I'm going to get him to rub his right foot against his left shin and his left foot against his right shin. Okay, good job. So next we're going to do your lower extremity standing. So can I get you to stand? Excuse me. Okay, so can I get you to walk on your heels? All right, come back. Walk on. And now can I get you to walk on your toes? All right. So we're gonna do the rumbar test next. So I get you to close your eyes and stand. Okay, you had a slight sway, which is expected. All right, so now I'm gonna check his spine. Can I get you to bend forward? Inspecting, palpating. Spine is straight, no curvature, no lumps, bumps, nodules. All right, get you to stand. Can I get you to bend backwards? Bend forward. Touch your toes. All right, side to side. And that concludes the physical assessment. Thank you, and thank you for my client here. Yeah, wait.